So our first topic is going to be theories, and I just want to kind of go through the different types of theories, which theories are involved under that kind of umbrella category, and then the different theorists that are going to be important for you to know. I like to color code my flashcards. It does help when you're taking the test. So my kind of umbrella topics are going to be in blue, and the first one is developmental theories. These help to examine, assess, and appreciate the patient's development throughout the lifespan. So this allows us to understand how the patient should be responding to their environment, to other people, to their families, and to their illness. It's very important for us to be able to treat the patient as a whole, to understand where they are in their psychosocial development, mental development, emotional development. All of these are very, very important. So just another study tip on my flashcards. I'll describe the theory here on top, and then down here, I'll put why it's important to nursing care. So my umbrella topic, which was the developmental theories, that was in blue, my subtopics are going to be in green, and we're gonna start with biophysical development. And this tells us how our physical bodies grow and change as we progress from infancy to adolescence to adulthood to middle adulthood and late adulthood. Why we use these theories? Well, it allows us to assess the patient's physical development at any age. It's especially helpful for infants and children. And it provides us with a lot of questions that we can ask ourselves and the patient, the parents, our doctors. We should be asking ourselves, what stage should this person be in at their age? What should their height and weight be? How many words should they be able to say? Can they form a sentence? And then you want to ask yourself, what factors can prevent someone from reaching their physical development that they should be at according to the average norm. So if you have a 23-year-old who can't walk standing up straight, you want to ask yourself, okay, is there something wrong with their bone structure? Are we having some muscle atrophy here? Things like that. So it is a really useful tool while doing nursing assessment. So my umbrella topic of developmental theories was in blue. My subtopic of biophysical development was in green. My actual theorists are going to be in pink. And here we have Gessel's, it could be Gessel, I really don't know. Gessel's theory of development. And what this is it tells us that there is a set genetic pattern that a person is going to follow that's going to lead their growth and development. It's going to tell us how tall they're going to be, how much they're going to weigh, the circumference of their head, their eye color, skin color, everything. So this genetic predetermination can be influenced by environmental factors like chronic disease, malnutrition, just several things that can stunt someone's development. And this is a good assessment tool because it allows us to look for these if this person isn't following the pattern of development that they should be. Within this theory, there are two patterns of growth that every human does follow. And first we have the cephalocaudal development, which tells us about the development at the top of our bodies. So this is just really common sense. Basically tells us that our brain and our head are going to develop before we develop arm coordination and fine movements and things like that. It's just kind of the pattern. And then we have proximodistal development, and this starts from the inside of our body to the outside, and it begins with our organ systems. So what this tells us is that our internal organs and organ systems are going to develop and mature much faster than our arms and our legs are. And if you think about it, that makes sense because you have to have your cardiovascular system, your nervous system, your digestive system, all of that has to be functioning in order for the rest of your body to grow and mature. So that's going to be it for our first video Now remember, we have our umbrella topic is developmental theories. We have our subtopic of biophysical development, and our theorist for biophysical development is Gessel's theory. And this is kind of how I go about with everything. So my next topic, we're going to be doing psychosocial, which is my favorite. And we'll do different theorists within that topic. If you have anything you want me to cover, let me know. I'm kind of just going in order here. And I will see you next episode.